Hey guys, Tom here, just making this video in response to a question I get a lot. I get this one all the time, so I figured it makes sense to make a video, and then if I get it again in future I can just direct you here to watch it, and obviously you can refer back to it. So that is dealing with knee pain and what to do about it. So I'm going to run you through the supplements you should be taking, and then just a couple of stretches and exercises and foam rolling as well, which you should do to help to alleviate this. As always, if it's really severe or if it's a specialist case, then my recommendation would be to see a physio. I'm no physio, but I will tell you what I know works, and it will certainly help, if not heal. So what you want to do first of all is make sure that you are taking the supplements that you should be taking anyway. That's vitamin D3, that's your omega-3 fish oil, and that's your zinc and magnesium, okay? Make sure you're taking those supplements, the required amount, it's all written in the start pack, every day, consistently. That's your first protocol. Second thing that you might want to do and experiment with is wearing a knee support while you're training, okay? And that will just obviously help to support the knee and take a little pressure off the joint. Right, the third thing that you want to do in terms of exercise, remember I'm always talking about stretching hip flexors and strengthening extensors. So what you want to do is, just like we do at Fitness Camp, that is those glute strengthening exercises from here, hips up, okay, in its easiest form, make it slightly harder, nice and slow, keeping your glutes fired up, okay? Like so, take your time with it. If it hurts your lower back, then let your hips drop a touch. Harder than that still, hands across here. I hope you can see this in the video. Like so, okay? So strengthening up those hip extensors. Again, a lot of people are underactive in their glutes and their hip extensors, so they compensate with their quads. And that puts a lot of pressure on the knees. So you're gonna strengthen up your extensors, and then what you're gonna look to do is stretch your quads, like so, okay? Remember, if you don't feel this, bring the leg back slightly. So stretch your quads on each side, okay? And again, remember when you're holding stretches, 1 to 2 minutes each side. And again, they've got to be every day. So you're going to stretch your quads, you're going to stretch your hip flexors, like so, which will show you every time. Again, 1 to 2 minutes each side, okay? You're going to stretch your hamstrings, which we do at camp all the time, like that, or even one leg at a time, if you can't feel it. And then you're going to stretch your calves from here, okay? Push the leg down to the floor, keep your heel driven into the ground as you do it, okay? Like so, and on that side, again, all 1 to 2 minutes, like so, okay? And then, what you're gonna do is get yourself a firm foam roller from eBay, Amazon, Google it, wherever the case is, okay? Firm foam roller, it doesn't need to be as long as that when you get a half length, and then you're gonna roll your hamstrings. You're basically gonna roll the areas that we've just stretched, okay? So you're going to roll your hamstrings from here, like so. If it feels like it's not doing much and it doesn't feel uncomfortable, cross the leg and put all the weight onto one side, okay? But if it feels really, really uncomfortable, then do both legs at once. But you want to support your body weight, okay? Then the way to foam roll is you find a point that feels particularly uncomfortable, hold it for about 30 seconds on there, let it do its thing, and then just working around this area, okay? And the way to think about this is as a deep tissue massage. So really just working out any tension, any knots, and any trigger points that there are in the muscles, okay? So you do your hamstrings, like I say, 1 leg or 2 legs. Hamstrings, your quads, so you literally turn over and do the other side. One thing to note with a foam roller, don't go directly over the joints, but you can go from the top of the knee to the bottom of the hip, okay? So up and down the quads, up and down the hamstrings, up and down the calves, and again, if it feels really uncomfortable, it means it needs work. So just keep working it, and again, just think of it as massage and just work out the tension, okay? 2 legs or 1 leg on each of those. And then the last thing you're going to do, I'm going to improvise a little bit here, I'm going to use my drinks bowl, get a can of deodorant or a rolling pin or something like this, and roll your feet as well, okay? That sounds strange, I'm going to tell you why you can do all these things in a minute, and just working out any tension in the feet, like so. Okay? And if it feels uncomfortable, that does feel quite uncomfortable for me there, then just make sure you do lots of it. And again, every day, as much as possible, a couple of minutes each side for the stretches and the rolling, and just really working out the tension in the muscles, in the legs, in the feet, okay? Basically, really, really quickly, why do we do this? I know you want to know why. So when you squat, for example, the way you've got to think about it is your ankle, your joints move, essentially. Your ankle moves as you come down, your knees move and your hips move. If your ankle's not mobile enough, what will happen is because the ankle can't bend, again I don't know how much you can see this video, but I hope you can see it. Again, the ankle can't bend enough. If the ankle doesn't bend enough, then the knees are going to come right forwards, over the toes, and again that puts a lot of pressure on the knees. Okay, so the idea is to mobilise the ankle, and because the calf starts right round on the foot, it comes all the way up across the knee, it starts with tension here. So if you've got a lot of tension here, again that's going to decrease ankle mobility. Okay, so you're going to roll the feet, you're going to roll the calves, and that's going to increase ankle mobility. And again, rolling and stretching the quads and strengthen the knees takes the pressure off takes the overcompensation from the quads, and strengthen the knees gets you squatting correctly. So when you're coming down, you go driving through the glutes rather than your knees coming forward and pushing up off the quads every time. Okay, so that's it. You are going to do one more time, run through it. You're going to make sure you're taking the supplements you should already be taking. Vitamin D3, fish oil, zinc and magnesium, okay? The fish oil morning and evening, the D3 morning and evening. I mean, when the sun's shining in summer you can take one a day, but generally I'll take 2 a day. And this is all my protein, getting more from my protein, just comprehensive, easy. And I know that supplement this well, okay? So zinc and magnesium an hour before bed, D3 morning and evening, fish oil morning and evening, okay? Then you're gonna get a knee support. So while you're training, experiment with knee support, you might find that helps, okay? Then you're gonna strengthen your extensors on there. You're gonna stretch your flexors, your quads, your hamstrings and your calves, and then you're gonna roll your feet, your calves, your hamstrings and your quads, okay? That is it. Like I say, if you're having really severe symptoms, then speak to a physio or speak to me about speaking to a physio, but you will find that this helps no end. But you have to be consistent. You've got to do it every day, okay? As with anything. For it to work, you've got to be consistent with it. Right, let me know if you've got any questions with this. I will speak to you soon. Cheers.